Thank you. Good morning, Darlene. And thank you for being willing to come on this morning and talk with us about Black History Month. You're absolutely one of my favorite people, and I'm so glad I have the chance to share this information that you're bringing today with my followers. So first of all, tell us a little bit about yourself.
Well, as you said, my name is Darlene McDonald, and I am I'm the National Committee Woman for Utah currently. And I'm born and raised in Ohio. I am now definitely a Utahn. And it is a pleasure to be here to talk to you this morning.
Great. Tell me, it's Black History Month, and one of the things we're focusing on are some of the things that members of the community deal with and are focused on and are experiencing here in Utah. So my question is, do you feel the health concerns of Black people in Utah are on a par with those of other Utahns, or are they different in any way?
Well, historically, and this is true for Utah as well as around the nation, around the country, that there are health disparities in communities of color, and especially in Black African American communities. We know that women of color, especially Black women, die disproportionately during and immediately after childbirth than their white counterparts. We know that African Americans have a higher incidence of hypertension, heart disease. We know that when they are diagnosed with cancer, they have a higher mortality rate as well. And even for Black women, when they are diagnosed with breast cancer, that unfortunately they succumb to that cancer. So the health disparities within the communities of color, and especially within our Black community, is extremely important. And we work with our doctors of color, and even non-doctors of color, so that they understand about these disparities and will be able to approach them and even create a care plan specifically geared towards you, knowing that the health disparity and historical health disparity.
I find that just striking, and I wonder, is this the result of intentional discrimination? Or is it the result of unconscious bias or some combination? I mean, and maybe that's what we're trying to figure out. Maybe there's not a good answer to that question because people really don't know at this point. But are those, I mean, I guess I'm just asking, do we have a better idea of why those things exist in the first place, those disparities?
Yes, we do. There are many studies out there that speaks to this issue. There are now new books out that speaks to this issue. And unfortunately, the understanding of systemic racism within our healthcare system is lacking. And we have many state legislators and legislatures that are removing the ability to even study this. And unfortunately, this is happening here in Utah as well. We have to understand diversity within our state and even within our country. And in that diversity, we have to understand what is systemic racism. And systemic racism and how it shows up in our healthcare systems. I will give you a perfect example, and this is a sad example, but it is very true and very real, that when you are treating women of color, especially Black women, doctors will not provide or prescribe pain medication at the same type of rate that they would for our white counterparts. The reason for that is a very historical racist idea that Black women don't experience pain. And this is even true today. Tennis star who is now retired, Serena Williams, actually wrote an op-ed about this because she almost died after she gave birth to her daughter. Beyonce, everyone knows the Queen Bee, also experienced the same thing and also had complications during her pregnancy because doctors don't listen to especially Black women when they say they are in pain. So it is important that you have a doctor that will listen to you first and foremost and treat you accordingly. And this is just a side effect of systemic racism. And we have too many state legislators who will deny that systemic racism exists, unfortunately.
Yeah, interesting. And I'm sure we'll gain more information as we do more studies. So it's a cycle. If you're not willing to provide resources to get to the bottom of these disparities, it's very difficult to end the disparities or to make progress on ending the disparities. Let me ask you this, Darlene. How did COVID-19 play into these disparate health outcomes and the experiences of the members of our Black community?
This was hard for me because we lost some good people during COVID-19 pandemic. What COVID-19 pandemic did was it revealed the health disparities within communities of color. And it wasn't just the Black community. We had AAPI community as well, our Native American communities as well, where they died disproportionately due to the COVID-19 virus. Most of it was because of lack of care. And also, another thing is they were the ones, many of our people of color are on the front line. They work in the types of jobs that you don't get to work from home. You go in and you're checking people out, you're driving the bus. I have memories of the very sad story of a bus driver, I believe in Detroit, Michigan, where he was begging the people who was getting on the bus to wear a mask, and they wouldn't, and he contracted COVID-19 and died. There are Black doctors, same thing, Black doctors who contracted COVID-19, was in the hospital, was saying, this is what's wrong with me, this is what's wrong with me. Even though they were members of the medical community, they died as well because they were not listened to either. So COVID-19 revealed disparities within our communities of color. And unfortunately too, it also revealed the historical distrust that is within our community towards the healthcare providers and even the medical community because of the history of testing within African American communities and medications being given to African Americans that were used for tests. I know you and many people may be watching this know that I'm thinking about the bad blood experiment, the Tuskegee experiment where Black men were not treated. It wasn't that they were given the syphilis virus, they were not treated for it so that the medical community could gain data on what would happen to untreated syphilis. So these types of things really impacted how Black Americans perceived vaccine and even the virus within itself. So
Are the vaccination rates lower among Black Americans than among other Americans, Darlene?
they were during the height of the pandemic. I believe that has shifted now. I haven't looked at the latest data, but at one point they were, and it was a combination of access to the vaccine and also distrust of the
Right.
vaccine.
Right. Interesting. So fascinating. It reminds me how much we drag into the present historical uh, uh, history and historical behavior. We just can't say that history is history and now we start over and have a blank slate. We're always reliving the past in one degree or another, or at least experiencing the effects of the past. So let me ask you this, Darlene. Are there disparities that you see in Utah based on rural and urban settings?
I believe there's a link, especially when you're talking about access, especially. Okay. So within urban settings, and if you're talking about communities of color, it's not necessarily access is an issue, and it becomes an issue based on how far you have to get to care, what type, the quality of the care as well, and being believed when you are sick, and also factor in cost of care, because that will impact whether or not someone will go and seek care from a doctor. If you have to worry about paying the rent versus getting your tooth fixed, what could lead to an abscess, what could lead to many health issues based on your tooth, that's a factor. When you have in the rural communities access to care, making sure that you have hospitals in rural Utah, making sure you have quality doctors, even access to just an urgent care facility. You may not necessarily need to go to the emergency room. You may just need hopefully, a family practitioner, a family doctor, and being able to access that. That is what links many rural communities with what happens within the urban community when it comes to access to care.
Interesting. Well, thank you so much for talking with us this morning. Anything else that you'd have us know about the experiences of the members of our Black community in regard to healthcare?
Well, yes. It is quality of care is really the key. There has been a survey, actually a study that was put out within the last year. And yes, within the last year that says that if an African American community has within that community doctors of color, their mortality rate increases. They live longer. And that is directly linked to having doctors that understands the historical nature of hypertension, blood, heart disease, cancer, that sort of thing, and knows what to look for when they treat you. I myself have a fabulous doctor, and I walked in, he's not African American, but the very first time, and I actually just shared this with him recently, what made me trust him even more was the very first time he saw me, he knew the historical nature of what to treat and what to look for within your African American community. He knew that. And that was our very first conversation. And so he's fabulous.
Thank you. You know, neither you nor I have mentioned DEI in this conversation, but what you just said is a powerful testimony to the importance of DEI.
Yes, it is.
Thank you. Thank you. It's been so good to spend time with you this morning, Darlene. You are just an exceptional member of our Black community, and I appreciate that, and I appreciate your activity in all things current affairs in Utah. We're so much the better for it. So thank you.
Thank you.